Super. Let's do this. All right. Thank you very much. So a big question I always get is from um, patients and from physicians, how to choose the appropriate probiotic for your patient. And so I'm going to give you some information on the recent research and see what we can do. So the basic probiotic definition that has been agreed upon by the World Health Organization is that they're live microorganisms which, when administered in adequate amounts, confer a health benefit on the host, which means something to scientists and researchers. But to physicians and patients, it's kind of going, okay, so they have to be alive. I get that. They don't quite get the dose amount, and it confer the health benefit on the host. It's a very soft definition for probiotics, but the reason why is that it's the product probiotics and prebiotics are a huge world, and they have, again, as we've seen, many different formulations. This picture shows that the probiotics can be a yeast, they can be a bacillus, lactobacillus, they can be streptococcus, so they can be many different forms. And what are some of the challenges for clinical use for probiotics? Again, this is something that's a global problem. There are different regulations from country to country. How they're used is different by prescription versus over-the-counter preparations. There's a wide variety of probiotic products, which we all are very, we know this very well. But interestingly, there are also differences in quality depending on which manufacturer is taking charge of it. And there's also conflicting claims for use. So it's not an easy thing to pick the appropriate probiotic. And in the United States, again, there's two major pathways for probiotics. You can go through the typical Food and Drug Administrative for approval process for medications, which is it's a long process. You go through preclinical phase 1 through phase 3 trials. But probiotics are also available here as dietary supplements. After 1994, the Dietary Supplement and Health Education Act allowed probiotics and prebiotics to be sold over the counter, but doesn't allow drug claims. So on the label for these probiotics, you'll find structure and function claims, which are basically enhances your immune system or regulates your GI tract, which satisfies the content of the law, but doesn't really give that much guidance to patients. They also have an FDA disclaimer that you cannot diagnose, treat, or cure disease. So it's not a medication that's been approved by the FDA. But a lot of the public does not get that distinction very well. So the problem is that a patient comes and they go to the grocery store and they look at this wide variety of different products. And if we've seen from the previous speakers, there's many different formulations. There's chocolates, there's capsules, there's yogurt. We did a survey from 1973 to 2020. There are over 260 different types of probiotic products found globally. So it's a big challenge for patients, and some of them are good and some of them are not so good. So when should we use probiotics? This is a question I often get from patients, is that when should I be taking this? Should I be taking probiotics every day like vitamins, or when should I take them? And I think the message is that you really need to recognize their main purpose and benefit is when the normal flora has been disrupted. As we all recognize that there's a normal protection from the normal flora, but when it's been disrupted by antibiotics or surgery, other medications, travel, stress, especially these days of COVID pandemic, we have lots of different types of stress. So people are under a lot of stress, and so they're wondering, should they take probiotics? Older age, comorbidities, hospitalization, and chronic GI disease, all this has a really big impact on your GI tract, opening up the opportunity for opportunistic pathogens to come. And so this is really the time that probiotics they're at their best. If we've looked at 250 randomized controlled trials and go, well, what is the health benefit? How do we know that something has a health benefit? We can go to randomized controlled trials. There's a surprising number of randomized controlled trials out there using all the different types of probiotics. And as this graph shows, that there's really a wide and 59 different types of diseases that probiotics have been tested in. So most of them, 19%, for the treatment of acute pediatric diarrhea, prevention of antibiotic-associated diarrhea. And then we have some chronic conditions like 12% of inflammatory bowel disease, irritable bowel syndrome in 11%, peptic ulcers, traveler's diarrhea. Interesting, we climb out of the GI tract. 5% of the randomized controlled trials have been done looking at allergies, treatment of adult diarrhea, lowering cholesterol. Again, stepping out of the GI tract, there's been studies in vaginitis, Clostridium difficile disease, constipation, cancer, nasogastric tubes, dental, and a miscellaneous type of disease indications. Not all probiotics are effective for all different diseases, but it's interesting to note how much interest there is in the different types of diseases. So microbiota, let's not forget, is important not just in the GI tract, but other places in our body. This is a very simple slide for the mechanisms of action for probiotics. Basically, it can be divided into three major ways, and the probiotic can come and fight against the pathogen itself, either directly by inhibiting, which we've seen in the past lectures, do a very good job at killing the pathogen directly. A huge area of mechanism of action is immunomodulation. It can either stimulate or downregulate the immune system depending on the pathogen, depending on the probiotic strain, and also can act as an additional barrier and excluding the attachment of pathogens to the GI tract. So, I mean, the advantage of probiotics is that they are living organisms, and as a living organism, they are found in the environment. And so it's a very competitive environment. And so they have to have lots of ways to fight off their competitors. But fortunately for us, the ways that they can fight their natural free range sort of enemies also works in the GI tract and in other areas in the human body to help prevent disease. So it's our advantage of using living organisms. So let's go back to the question, how do you choose a probiotic? Very simple things, because the label for dietary supplements, and in Europe, I think also the labels can be not so helpful for the patient, but at least does it follow the regulations in your country? And if you can, try to link the disease pathogenesis to the mechanism of action. So if you have inflammatory bowel disease, you want to pick a probiotic that has some immune regulation to it. What's interesting is that in 2018, a paper came out that really defined the fact that, and answered hopefully the question, are all probiotics the same? Well, no. The efficacy is strain specific, so it depends on the strain or the strains and efficacy. And it's also disease specific. So if you have a strain like Lactobacillus GG that works well for one disease, does that necessarily mean it works for other diseases? And what we found was that no, it doesn't. It has to be both strain and disease specific. You also need to balance efficacy with safety. Safety is a very real concern. Most probiotics have a really very excellent safety profile. They're safe to use, but again, contraindicated in immune compromised and patients that have especially central catheters. And another consideration it's very different for the normal public to consider is that the fact that you have to choose a good quality product. So we're not used to looking at who manufactures a product, but the ones that are an established manufacturer have good manufacturing products and quality control. You have reassured that that's a good product. But if unfortunately with the internet, you can also pick up products, probiotic products that don't list a manufacturer. That's always a red flag, a warning. Or if you go to their website, it's not high quality. So I always try to tell my patients to steer away from probiotic products that are on the market that don't list who manufactures them, because then you have no assurance that you're getting a good product. So is there strain specificity? Again, this was a study that was published in 2018. And what we want to look at, this is a meta-analysis where we looked at some very common probiotics that are used for the prevention of antibiotic-associated for adults. And what we find is that here are some studies that meta-analysis allows you to pull the results of studies and come out with a pooled relative risk. And what we find for Saccharomyces boulardii is that yes, this it significantly reduces the risk of AAD to 0.76. And Lactobacillus GG, however, it's not significant. Oops. Let's go back here. Lactobacillus casei, which was a yogurt, was significant. Lactobacillus acidophilus and Bifidobacterium was not significant. This other form of 3 different lactobacillus strains was significant. So it depends on the strain of whether or not it's significant. Is there disease specificity? Here we took one strain, Lactobacillus rhamnosus GG, a very common type of a probiotic that has lots of research, and not all probiotic strains have all these different types of diseases that have been investigated with it. And here we find for Lactobacillus GG, it was effective for preventing pediatric AAD, antibiotic-associated diarrhea, but interestingly, it was not protective for adult antibiotic-associated diarrhea. The confidence interval includes 1. Several studies looked for Crohn's disease. It was not specifically significant for that disease. And for C. difficile infection, this also was not significantly protective. So you have a strain that's very good for one disease, but it's not necessarily good for all different types of diseases. So Sniffen published a paper in 2018. It's open access, so patients can get this, physicians can get this. And what he did was to look at over 259 different types of randomized controlled trials. And it's hard to do a meta-analysis on all the different types of diseases because sometimes they use different outcomes. So they just looked at whether or not how many studies had a significant result and how many had a negative result. So if we look at antibiotic-associated diarrhea, there were 60 randomized controlled trials. For Saccharomyces boulardii, 18 of those trials were positive and 9 were negative. So it doesn't necessarily work in every single trial. There's lots of reasons for that, study size, et cetera, et cetera. So he said this is a strong evidence that this is a good probiotic to use for AED. The combination of the 3 lactobacillus strains, which with a Canadian probiotic called BioK Plus, has 3 studies that were positive and 1 were negative. Lactobacillus casei strain DN114001 has 2 studies, so not quite as many, but none of them were negative. And so these, if you are trying to prevent antibiotic-associated diarrhea, you would go to this chart and go, okay, I'm looking for probiotics that contain one of these 3 strains or different types of mixtures. Moderately, Enterobacter faecalis had 2 positive and 1 negative, so there's only the net of +1, so it's kind of mild research. But interestingly, if you look at weak evidence, so they don't have a net positive number of positive studies over negative studies. We find these other types of probiotics have more negative studies than positive. If we look at the prevention of C. difficile disease at 23 randomized controlled trials, we didn't find any that were strongly negative, strongly positive by themselves or moderate. Most of these were negative. These were taken because for the prevention of C. difficile diseases, there aren't a lot of studies that have been done because it requires huge sample size. And so most of these were taken as secondary outcomes, and C. difficile was underpowered. So that's why many of these were negative. The outcome was AAD, not C. difficile. So it was sort of a secondary finding. So if you just look at that, you would think that there aren't any to prevent C. difficile, but I'm going to show you how we can overcome that obstacle. For nasogastric tube diarrhea, the prevention of that, Saccharomyces boulardii has 3 positive and no negatives, and there's no other probiotics that really had more than 2 randomized controlled trials for this. Traveler's diarrhea, Saccharomyces boulardii has kind of a moderate evidence. Lactobacillus GG just had 1 study that was positive and 1 was negative. So if you're trying to prevent GI diseases, I'm saying to my patients that they should take this chart to their pharmacy and look down this column and see which type of disease they're trying to prevent, and then try to find the probiotics that have these strains. It's not easy. Okay, so how do you adjust for the problem of low power for the prevention of C. difficile? If we look at, we can take a meta-analysis. So here are there were 3 randomized controlled studies. One of them had 2 dose treatment arms. You do a meta-analysis of these 4 different treatment arms and combine them together. And here we can see that it overcomes the low power problem, and we see there is a significant prevention of C. difficile with BioK, the 3 lactobacillus mixture. So this is a good way to do this. This was published in 2018. And then what happens if you already have a GI disease and you need to find a probiotic to help treat it? Again, this in the same paper of 2018 by Sniffen, he went to how do you treat acute adult diarrhea? There's 9 clinical randomized controlled trials. Saccharomyces boulardii has strong evidence. Faecalis has kind of moderate evidence. The treatment of pediatric diarrhea is a huge indication that lots of randomized controlled trials have been done. And as you see, over 62 randomized controlled trials, and there are many different types of probiotic products, either single or multiple mixtures, that seem to be very effective for the prevention, for the treatment of pediatric diarrhea. This combination of 2 lactobacillus nuts, there's 3, the randomized controlled trials, 2 were positive and 1 was negative. So we don't really, we're not quite sure about its effectiveness, but there are plenty of candidates here to choose from. 2, you can also, if a person has C. difficile disease and you want to prevent a recurrence, there's only, as like I say, 4 randomized controlled trials. Saccharomyces boulardii was effective for that, but Lactobacillus GG, both of their studies were negative. For colic, again, Lactobacillus reuteri, 4 randomized controlled trials. All of those were positive, so that looks very promising. Constipation was another treatment area. None of the 3 randomized controlled trials came up with a probiotic that could be recommended. Bacillus lactis has 2 positive and 1 negative, so we're still on the fence about that one. Inflammatory bowel disease, 25 randomized controlled trials. So as you see, even though it's not an acute disease, it's a chronic disease, lots of randomized controlled trials. This mixture of 8 different strains, BCL number 3 is the strongest for that. Saccharomyces boulardii and medium, Lactobacillus GG, 6 negative studies and only 1 positive, and E. coli Nestle has 5 negative ones. So also for the treatment of irritable bowel syndrome, there have been 21 randomized controlled trials with 2 probiotics that have strong evidence for the fact that it might actually work, and several that didn't work at all. So you look at Lactobacillus and Saccharomyces boulardii, which are very effective for many of these other types of diseases, but not effective for irritable bowel syndrome. So this is the disease specificity once again illustrated. What about other diseases? So you get out of the GI tract sometimes, and H. pylori, not so much to eradicate H. pylori, but to eradicate that. The typical treatment is either a triple or quadruple treatment containing some very strong antibiotics. And many of the patients, nearly 40%, can develop diarrhea as a side effect, then they stop taking their eradication therapy. So the idea was to add a probiotic, which we know prevents AAD, to increase the compliance. And what we found is that, yes, this was a good strategy for increasing compliance. 15 randomized controlled trials, again, a couple of strains that are effective, Lactobacillus GG, 3 positive and 2 negative. For necrotizing enterocolitis, we have 10 randomized controlled trials, and unfortunately, none of the probiotics have been very promising yet. So we need to do more research on that. They've looked at whether or not you can prevent other types of non-C. difficile nosocomial infections with Lactobacillus GG. It had a positive study and a negative study. So the jury's still out on that one. Post-surgical infections, none of them have been strong. There's only 3 randomized controlled trials with Lactobacillus plantarum, 2 negative and 1 positive. Interestingly, for respiratory tract infections, 11 randomized controlled trials, none of them have been significantly positive overall. But Lactobacillus GG has 3 positive and 3 negative. And this year, as we re-examine some of that data, there's actually 5 studies for Lactobacillus GG that prevent respiratory tract infections. So we might want to move this up to strong evidence. So as you see, research changes every day. So it's tough to come up with a table that's good for more than a few moments. Urinary tract infections are not quite as well studied, only 3 studies with Lactobacillus GG, and all were negative. So this is a tough thing to be able to match your strain with the disease. Quality control examined this study in 2017, examined 19 studies and looked at also 16 commercial products and tried to match their claims on the label. About a third of them contained fewer organisms than on the label. Contamination was found in about 5%. And decreased functional properties were found due to changes in the manufacturing processes. So the way that not only formulation makes a difference, but how they're being manufactured makes a difference. So just because they're on the products and on the shelves and available does not mean you're getting a good quality product. And that's why I always say, look at the manufacturer. Do they list a good manufacturer? And lastly, what about safety considerations? If we look at all the over 250 randomized controlled trials, there were no serious adverse reactions. However, those randomized controlled trials are usually done with a small amount of people, but we do see some mild to moderate adverse events, including nausea and vomiting, increase in gas, and constipation. All these are very temporary and tend to go away fairly quickly. But probiotics are contraindicated now for infants that are in ICUs with central lines. And you also have to consider the interaction between the antibiotics that people are getting and the probiotic sensitivity. So if the bacterial if the probiotic is a bacteria, is it susceptible to the same types of antibiotics that the patient is taking? So this Jason paper, Sniffen paper also gave a nice algorithm of how to choose a probiotic. And again, the first thing you want to look at is why the probiotic needed is in the first place. Are you trying to prevent disease? Or are you trying to treat an established disease? You have to just determine that for the disease itself. And then you have to look at the strain, used evidence-based efficacy from clinical trials to choose a strain or a mixture of strains that has good evidence for it. Choose a quality product that has the appropriate strains. Consider the source of manufacturer. Does the product comply with the country regulations? Again, different in Europe versus the United States or Australia. And then recognize that dietary supplements have to have FDA disclaimers if you're in the US, but they should list an established manufacturing company. That should be, the probiotic strain should be listed, provides a daily dose information on the label, and gives an allowable structure or function claim. If the probiotic is a drug product, then the nice thing is that you can go to your physician or pharmacist with our healthcare provider and get advice, assuming that you have a well-educated and up-to-date provider. Maybe adjunct therapy to standard therapies like for the eradication of H. pylori. You need to review the contraindications for patients and to review the antibiotic and probiotic drug interactions. So it's not a simple thing, but it can be done. And I think our role as scientists is that we have to continue to try to educate our patients and our pharmacists and our other physicians about how to choose a good probiotic. And lastly, what about probiotics in the COVID-19 pandemic? Probiotics, I think we'll be hearing a lot more about probiotic use, how we should be using it in the probiotics in the COVID-19 pandemic. Currently, if we look at GI problems in COVID-19 patients, 5% report GI symptoms, 19% in severe. 72 to 95% of severe COVID patients in ICUs are on antibiotics to prevent secondary bacterial infections like pneumonia. And so we're seeing more antibiotic use. The question is, are we going to see more increased AAD and C. difficile cases? We have to wait and see. What is the evidence for probiotics and respiratory infection? Some lactobacillus probiotics can induce antiviral cytokines, resulting in less lung tissue damage. Some probiotics can prevent upper respiratory tract infections, but we don't know, there's no evidence right now currently of which probiotics are effective in COVID-19. So I think this is an area of future research, and these are some of the questions that might be coming your way as patients are beginning to wonder, do we use probiotics for COVID-19? So where to find information on probiotics? Go to the scientific literature. There's some review articles that are a little bit more easy for the consumers and your patients to understand. This is an old one from 1915 from Yaxed Yogurt, but it was published in Clinical Infectious Diseases, which is open to download, and it's a very nice but simple summary and review. But there are other ones in the scientific literature. You can go to consumer books on probiotics and also go to National Health Organization websites to get what's currently seen. The problem is, of course, on the internet, there's lots of different types of informational websites. Not all of them are as good or reliable or valid as others. So you have to also be careful about what websites you're taking.